Hello, my name is Hannah Steinstorfer, and today I want to talk about workforce shortages. This is directed towards our staff for any future training so we know how to detect workforce shortages, what's occurring, and how we can improve. In these slides, I plan to describe a specific managed care, human resource, and operation issue that is workforce shortages, and how that issue impacts our organization as a whole. I also plan to explain the impact the issue has on our organization, but also society. I want to include how this affects patients and providers. I also plan to describe all evidence-based methods that can be used by our managers to help solve this issue. So without further ado, I'm going to get into the first slide and discuss this further. So for our first slide about workforce shortages, I wrote a little here about how there are a large number of nurses and physicians that do leave the healthcare profession, and this causes a shortage, which can then cause gaps in staffing and cause a lot of increased stress. With illness and cancer and so many things that are on the rise where people are needing treated and patients are coming in needing attention and care, we need our staff. We need people here more than ever to help the flow go forward. So on this, we're going to dive into how these shortages, how work burnout, how not having enough nurses or doctors, how that can not only affect our organization in a negative way, but also how it can affect the population as a whole. So with workforce shortages, the problem lies in every facet of our organization. This problem affects HR, it affects operations, and it affects our managed care as a whole. I broke down some of the main points I plan to go over and how this problem of workforce shortages affects these certain departments, and what specifically are you going to see in these departments that's being affected. So as you can see in HR, it has a lot to do with HR. They do hiring, they do training, they're helping with scheduling and just overall employment well-being. So with HR, it's going to affect these areas. It's going to affect your hiring. It's going to affect the support they're able to give. It's going to affect training and scheduling. In operations, we're looking at cost. We're looking at the quality and efficiency of what we do. How does workforce shortages affect these things in a negative way? In our managed care, we're focusing on quality again, but we're also looking at metrics. We're looking at our providers' availability and availability to those patients. We're also going to look into burnout, what that looks like, why is that happening, and what we can do to improve that, and how it's a big negative impact on this. So to deep dive into the HR section, hiring and retention. This is a big one. The constant need to fill open positions is a major challenge. It's exacerbated by high turnover and burnout rates. So we're looking at the need to fill positions constantly. And due to that turnover rate, we're having to hire people because we're falling behind. Next, right underneath that one is training. With training, we have to ensure all staff, especially new hires, have up-to-date skills. But this can be difficult when you're giving quality care. And with training, it's important for new staff just as much as it is for the existing staff to ensure you're up to date. Next, we're going to look at scheduling. Scheduling is a big one. If we do not have people that are able to cover, we're going to have higher levels of burnout. So with scheduling, we need to create complex and fair schedules to ensure adequate coverage, but also the key word in that is fair. It has to be fair. You can't have one person working more than other people. You are going to have someone burn out faster if you're having to constantly have the same people cover. It's going to cause major issues, and it can cause you to lose more employees because they're having to do more than what's normal, as if they had enough people to cover. Last one, we're going to talk about support, which kind of goes with employee well-being. So providing support, mental health resources, sustainable working hours is a big priority that goes along with scheduling, but is difficult to implement when staff are stretched thin. So we want support. We want to be able to support everybody, ensure all employees, they're doing well, they're not burning out, they're not having mental breakdowns during work, that they're at their highest level of capacity and they are able to operate well. So we want to make sure we're able to support them in a great way, and we can't do that correctly if they are stretched thin. Next, we're going into operations. So with operations, there's a couple other things we're going to be focusing on. One is cost. So high turnover and the need to offer competitive wages to attract talent increase labor costs, which can strain an organization's finances. So with our organization, it costs a lot more to keep on hiring individuals to replace individuals that were already had. So when there's a high turnover rate, there are labor costs. We have to keep up with competition. So it is important that we are doing everything we can to keep the employees we have, to not have a high turnover rate. So we're not spending those extra costs trying to get more people in. Next one will be quality. So when we're talking about quality, we're actually talking about patient care quality. Staffing shortages, they can lead to longer wait times, less time per patient, and an increased risk of medical errors. So when you're having a least amount of staff, there's people that are dealing with conditions that are in that waiting room. They're waiting for their turn. It's causing frustration. They're wanting to get in, they're having to wait. It goes into their time, but also when most people don't feel well, they're not going to be in a great mood either, which can also cause our staff to make mistakes because we're dealing with frustrated patients and we're not able to think clearly. Last one is efficiency. When we talk about efficiency, we don't want insufficient scheduling and a constant need to onboard new staff. It's going to disrupt workflows and decrease overall efficiency. If we're constantly having to train new staff, that is cutting into our time that we could be using for other things. One of the final things we'll talk about is managed care. So the first point I want to make on managed care and how work shortages can negatively affect this goes over quality and metrics. So quality metrics, we want to be meeting and maintaining quality metrics required by managed care plans, and that can be difficult when staff are overworked or unable to provide comprehensive care. So when we don't have a lot of staff, we are working overtime to try and catch up. It's an endless game of catch up. Next is availability. We want to make sure that we have access and availability. A lack of staff can lead to reduced capacity, longer wait times for appointments, and difficulty providing care to all patients in a managed care network. So it kind of goes along with operations. When you think about it, they go hand in hand with each other because, again, we're seeing this longer wait time and it is affecting our managed care. Last one is burnout. So when we're talking about burnout, we're talking about those nurses and those providers. When they have burnout and they've been overworked and they're just over it, they haven't had time off, The high rates of burnout among staff can lead to further turnover, creating a downward spiral that negatively impacts the organization's ability to meet its managed care obligations. That is something we definitely do not want. So as we can see, this is a significant issue. A chronic staffing shortage of clinical staff. It directly impacts operations, human resources, and managed care. The shortage leads to overworked employees, burnout, and a decline in patient care quality. For HR, it creates challenges in hiring, training, and retention. In operations, it forces complex scheduling, increased costs, high risk of medical errors, and managed care. It has affected the organization and struggles to maintain the required patient to staff ratios. So we can see this is a big issue in our organization itself. But this can also be really big on society. As said, on a patient aspect, this increases wait times and reduces access to care, which can worsen overall health conditions. And other societal impacts we'll get ready to talk about here shortly that are really big in our community. This slide is a reiteration of what was said previously. When we are having issues in an organization, staffing, the impact is going to be on these three major areas. So it is definitely something to be mindful of and how we need to operate in order for that not to happen. Because if we're having issues in staffing, these three major areas are going to be using up their time instead of working on other things to work on the staffing issue. So now we're going to get into society. How does shortages negatively impact a society? So I had said before how the increasing wait times, reducing access to care, and worsening health conditions, those are major things. I'm going to focus a little bit more detailed on these on this slide. So with patient care and access, we're looking at those increased wait times where fewer clinicians that are available, they lead to longer waits for appointments and treatments. We have reduced access, which means patients in rural areas especially may lack access to necessary care. This also can be referenced as healthcare desert, which means that patient doesn't have access anywhere else. There is nowhere nearby that they can go to get that level of care. Worsening conditions. So delays in care can cause illnesses to worsen, and it can become urgent, which we don't want that. That is something we're trying to avoid, and we want people to come to our organization and be able to receive the care they're needing. Another point is decreased quality of care. Overworked staff are more prone to make errors, and there's less time for each patient. That can lead to a decline of the thoroughness of care. Also, patient dissatisfaction. If patients are having issues getting into us to be treated and they're having to wait long times and having mistakes made, this means they may even have to come back for further care because they're not getting the right treatment. That's going to lead to dissatisfaction. They're going to be unable to receive timely, high quality, and can lead to frustration, reduced trust, and we want them to trust us. The next point is systematic and financial impacts that can lead to higher cost. So the reduced access to primary care can drive people to more expensive emergency room visits, increasing the overall healthcare cost. We want them to be able to come in to see their providers. When they're going into the ER, this means that they've worsened to a point where they're having emergent situations. And those ER visits, they're going to be more costly because more is going to be needed. Health disparities. Shortages exacerbate existing health disparities, and they often disproportionately affect vulnerable populations. So we're going to see some of our poor, impoverished, or critically ill populations that are being affected because they're not getting the care they need. Impact on public health emergencies. System is less resilient to respond to future health crisis when the workforce is already depleted. If we're having any sort of crisis going on in that community, they're not going to be able to assist in the way that the community needs. Workforce burnout. Again, we're going back to this burnout. The high workload and exhaustion that is experienced by the healthcare workers can contribute to further burnout, driving more professionals to leave the field, which worsens the shortage. And then additional consequences I wanted to talk about is morbidity and mortality. So if we're getting this bad, these impacts can lead to higher rates of patient mortality and complications. It also has an economic impact. The shortage can hinder economic growth and reduce workforce's overall productivity and limit opportunities for decent employment, especially for women and youth. So knowing how it has such a large impact, the question is, how are we going to solve it? Now, on this slide, there are two main points that I have made. One is we can go a short term, right? We can go immediate. We can hire temporary staff just to help supply and help those shortages. We can compensate our current staff with overtime work, utilize remote work as a possibility, and then cross-train employees to know how to do other things other than what's in their job title, and we can overall adjust operations on what is being done, how to make a process quicker. Now with this short term, it's a band-aid, right? It's not an end to what we need. This is just something temporary. So keep that in mind when you're looking at the short-term immediate. This is something just to put a band-aid on it. It is not something that's going to help in the over time. For the longer term, we are going to see burnout, even with this short-term immediate. You might have more people that are willing to help out, but over time, we're going to need a more permanent solution. So for long-term, offer competitive pay and benefits. So increase pay and benefits. Advertise that. You're going to get people that are going to want to apply, and those people will more than likely be more trained to do what we're needing them to do. Hire new employees with the training that goes along with that. We're going to be able to hire people that have the qualifications that we need them to have. So the hope is the training that they received once they come in, they're not going to need their hand held the whole entire time. We're going to be able to show them what needs done, and they're going to be able to do it, and we're going to be able to keep them. We also want to focus, and this is a big one, on improving company culture. A lot of burnout is sometimes due to their company culture. If it's a toxic culture, if patients are coming in and, not being treated correctly, and because, our nurses and providers, they don't have good etiquette, that's something we need to pay attention to. We need feedback on that. We need to know where our problem areas are. So we need to improve the company culture to make it a positive environment. And then that can also include creating opportunities to expand in career fields, incentives, benefits, things like that, that'll cause our employees and providers to want to stay on. So just to summarize it, staff shortages are a big issue in our healthcare, not only healthcare, but in other businesses. So as a healthcare organization, we want to make sure that we are being different than the rest, and we're able to keep on our employees. So to overcome this issue, we need to be aware of what's going on. We need to be aware of what all is being affected when we are having people leave. So to do this, we need to stay competitive. We need to create positive environments in the workplace. We need to try and avoid burnout, stay communicating and on top of giving those incentives and staying competitive with other businesses as far as pay goes so that we can keep those employees on to continue to help with our patients. I hope you learned some good information from these slides. I just wanted to kind of reiterate that staffing shortages, they are a big problem, so that we need to be well aware of what's going on in our workplace. And as an organization, we need to do better to make sure that we are keeping those employees on and we are being aware of what's going on behind the scenes, so that we're not having to go through the stress and cause stress on our current employees when we have someone leave. These are just a couple references that I sought out to help with this presentation. I hope you learned a lot. Thank you so much.